teams, Lauren and Rebecca here with Bizrok. In this week's video, as we wrap up our team operations training video series, I want to talk to you about documentation and notes, which, Rebecca, let's be honest, I feel like half of the practices that we work with, they're like, seriously, I hate talking about notes, but they're so important.
They are the most important thing, in my opinion, that can be done in your practice.
Yeah, well, and it's so easy, right?
It's so easy, but everything liability-wise falls onto your notes.
Yes.
And I just want to protect everyone in all of our practices that has a license.
Yes.
Whether you're a registered dental assistant, a registered dental hygienist, and or a doctor, I want you to be protected, and that all starts with having really, really great, exceptional notes.
Yes. Well, and you know my role, I've always said if it's not documented, it didn't happen.
It did not.
Which is crazy because when push comes to shove, our notes are sometimes what keeps us safe and keeps us out of trouble.
Absolutely.
And it allows us to hold our patients accountable. Now, I know that you're going to touch on some of the clinical side, but I want to start with the front office team because this is usually where I see a lot of, I'm going to say slack, and I say this word lovingly and respectfully. Guys, listen, hear me out. But if you leave a voicemail with a patient, you've got to document. If you have a conversation, you've got to document it. It keeps you protected. But it also, you know, from a team standpoint, it proves to your doctor that you did your job, right? So every time you leave a voicemail, whether it's a confirmation or a friendly reminder, hopefully it's friendly reminders, you notate that, right? Whether it's a voicemail or a verbal conversation, you've got to make sure that you're documenting that. Whenever you're presenting treatment over the phone or you're following up about treatment or following up about finances. Even if a patient calls the office and says, hey, I'm going to be there in 5 minutes. Great, I'm pulling up their account, I'm pulling up their notes, and I'm making patient running 5 minutes late. And I know that sounds so silly, but I think whenever you master those small things, those little things, it creates a more rigorous habit where you're documenting for everything. But it starts with every single team member taking responsibility for their own actions and their own conversations with patients and saying, okay, I need to make sure I document this, right?
Absolutely. And especially when you were talking about friendly reminders, if you're calling a patient and their voicemail is full, this has personally happened to me. Their voicemail is full, document patient's voicemail is full, unable to leave a message. I had a patient come in and say that we did not reach out to him at his home number in the past, and we actually called his home number with him there in the office because there were notes that said voicemail is full, and it had the team member's initials. So we called and we played his voicemail for him, and he's like, oh, I didn't realize it was full. So as long as you notate it, not only are you covering yourself, but you're covering your other team members. And that is the most important thing, is just to cover everybody in the office for liability reasons.
Well, I feel like sometimes in this day and age, there's so many people that don't want to take accountability for their actions, right? And sometimes the patients will put it back on us and say, you didn't call me, which friendly reminder teams, I do love our patients, but I love our teams more, right, guys? It is a courtesy whenever we call our patients. It's their responsibility to show up for their appointment, which is why at Bizrok, we practice friendly reminders, not confirmations, okay? But document that. You know, front office team, it starts with you guys, and then it's carried out to the back on the clinical team.
It is. So all notes for a clinical team, I always recommend doing them before the patient ends their appointment, if you're able to. If you're unable to finish your notes before your patient leaves your operatory, that's okay, because none of us have memories that are massive and we can remember all our patients all day, and especially putting in key information. I always like to get one personal note from each patient. I cannot remember if I've seen 20 patients today, 20 personal notes. I wish I could. So my suggestion is all your AM patients, finish your notes prior to lunch. So before you even clock out for your lunch break, please finish your AM patient notes. And then your PM patient notes finish before you leave for the day. And docs, this is major. Every clinician should do their own notes, assistants and or hygienists and front. But it also always falls on the docs to actually read and check the notes from hygiene and from their appointments that day and do a final sign off. So all your notes, if you're in the clinical space, should end with either the hygienist and or the assistant's initials / the provider that actually saw them that day, whether it was for a comp exam, an ER appointment, or just a perio check and or actual clinical appointment. All doctors should sign off their own notes at the end of every day just to make sure everything is done and all the information is actually put in the notes properly.
So true. Well, and for some of you, if you're like, oh my gosh, I'm hearing Rebecca say, like, try to do it before the patient's appointment ends. Like, how am I going to do that? Guys, that's why we're such big fans of having note templates per different procedures, which you're always going to change those.
Absolutely.
But it gives you the guide. It even if it cuts down on half the work, I'm like, that's a win. So just have those note templates. And if you're like, we don't have any note templates, here's where you can start with one. Start with one service or one procedure and create a template for that. Docs, this is where we really need you to get involved in this process, or reach out. I know some of the things that you cover in some of your clinical trainings actually talks about note templates and what should be included. And even, guys, we provide cheat sheets for every single procedure, but you've got to start somewhere, right?
You do. Our team optimization guide has templates, and every office is different. So I would consider our templates as a guide for the practices, but they can utilize them to make their own templates to make sure they have everything that needed in the notes actually in there. So it's like a plug and play. You just put in your template, plug in specific information for that appointment, and then sign it off.
Yes. Now, I know in previous videos, Rebecca, we've talked about pre-op and post-op. Will you touch just for a brief moment about documenting some of those phone conversations?
Yes. All phone conversations you have with the patients have to be documented. So whether it's pre-op, post-op, they want to speak to you because they don't understand why they need a crown on the upper right on number 3, always notate everything. Notes are important. I hope this never happens, but you may speak to a patient and they're actually coming in for the next day, and then you have a child that gets sick and or you are sick and you're unable to come in, and then the patient carries on the conversation from what you were talking to them the previous day. The doctor doesn't know what's going on and or other team members. So if you are unable to come in, they do not know what the conversation consisted of the day prior to actually finish a conversation with the patient, and you're catching everybody off guard, which isn't nice. You don't want to do that to your team members.
Yes.
So make sure you notate every conversation. If it's not notated, it didn't happen.
Yes. And docs, I know for some of you, you do such an amazing job of calling your patients to check on them from that day's appointment or the following day's appointment. And so you might be in your car and multitasking, and that's totally fine. But whenever you get back to the practice the next day, whether it's a talk note that you send to yourself or something, but right whenever you get into the office the next day, make a quick note. Just it allows you to be protected and protect your license, which, guys, our job is to help support you in that, but we need you to do your part too, which is notating it and taking those 5 seconds to protect yourself.
Absolutely.
Awesome. If you guys need any help, or if you're like, gosh, we really don't have any of these note templates that you're talking about, reach out to us. That is covered in one of our clinical trainings. So we'd love to help you guys and support you. Otherwise, we can't wait to see you and serve you soon.